Hi my dear nursing colleagues preparing for NCLEX. Today I will review with you some abnormal EKG graphs and how to answer them in NCLEX exam. In front of me here is this graph, and how can we answer this question? The first step is to know the number of hearts. We want to know the rates. So this is 1, 2, 3, 4. So we have 4 arcs here. So 4 times 10, that is 40 beats per minute. So the rate is 40 beats per minute. So the next thing is to calculate, is to access the rhythm. We can see that the distance from arc to arc, is almost equidistant. So it's almost equidistant. Another way to note this is to calculate the number of big boxes. For instance, from this arc to arc, how many boxes do we have? We have 1, 2, 3, 4, 5, 6, 7, 8. From this arc to this arc, how many boxes do we have? 1, 2, 3, 4, 5, 6, 7. So from this arc to this arc, how many boxes? 1, 2, 3, 4, 5, 6, 7, 8. So this rhythm is fairly equidistant, so we can say that it is regular. Now, does this graph have P wave? Yes, it does have P wave. It also has QRS complex and it has T wave. So all the waves are present in this graph. So understanding the fact that any rate below 40 beats per minute, below 60 beats per minute is sinus bradycardia. So this graph is sinus bradycardia. So this is the second question. We can see that this graph does not have P wave, does not have PR interval, and does not even have T wave. The only thing we can see from this graph is widened QRS complex. Widened QRS complex. You can see widened QRS complex. So, and then if we count the rate of this graph, I mean the number of hours, we will see that it is more than normal. For instance, we have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25. 25 times 10, that is 250. If you see this kind of graph in your patient, this is abnormal EKG rhythm. So we can see that the QRS complexes are very wide. The rate is so elevated, about 250 beats per minute. So if you see this graphical representation in an EKG graph, this means verticular tachycardia. Verticular tachycardia. So this is the answer. Verticular tachycardia. So let me choose verticular tachycardia, VTAC. So let's check the answer. You can see this is VTAC. For VTAC, the rhythm is regular and the heart rate will typically be greater than 150 beats per minute. The P waves will be absent and therefore there will be no PR interval. The QRS will usually be wide. So we can see that the QRS complex is wide, very, very wide, and the rate is more than 150 beats per minute. So this is ventricular tachycardia. So we got the answer right. So the next question here is, let's look at this graph. First, what is the number of hours? We want to calculate the rate now. What is the number of hours? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. So the number of hours is 16. 16 times 10, that is 160 beats per minute. We can see that this is abnormal. Now let's check the rhythm. We can see that the distance from one hour to another hour is not the same with the distance from this hour to another hour. You can see that the distance from this hour to this hour is different from distance from this hour to another hour. So the rhythm is not regular. The rhythm is not regular. Now, does this graph has P wave? No P wave. Q, but there is QRS and T, but no P wave. There is QRS and T, no P wave. So no P wave, 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 no P wave. So this seems to be atrial fibrillation. In atrial fibrillation, P waves are absent. P waves are absent, and the rhythm is irregular, and the rate is faster, more than 100 beats per minute. So I will pick atrial fibrillation. So let's check our answer here. So we can see we got it right. This is atrial fibrillation. For atrial fibrillation, the rhythm will be irregular and the P waves will be absent. Next question. Let's choose the correct rhythm for this rhythm strip. Like I have said before, the first thing we calculate is the rate, the number of hours. 1, 2, 3, 4, 5, 6, 7, 8. So 8 times 10, that is 80 beats per minute. 80 beats per minute. And is the rhythm regular? We can see that from this hour to another hour, the distance usually looks the same compared to other distances. So you can see that the rhythm here is regular. The rhythm is regular. The rhythm is regular. Or another way you can do this is to calculate the number of big boxes. 1, 2, 3, 4. So there are 4 boxes between these two hours. 1, 2, 3, 4. There are 4 boxes, 2 or 3 boxes. 1, 2, 3, 4. 4 boxes. 1, 2, 3, 4. 4 boxes. So we can say that the rhythm here is regular. Now, does this graph have P wave? Does this graph have P waves? Let's look. You can see that the P waves are more. The P waves are more. 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3. So the P waves seems to be more here. So how can we, and does it have QRS complex? Of course, it does have QRS complex, QRS complex, QRS complex. So this graph, does it have T wave? We cannot say if it has T wave or not because it looks so mixed up. So we can say that this graph is showing more P waves. You can say that this P wave is not followed by QRS complex. You can see there are more P waves. 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3. So there are more P waves. And the P waves here look so sawtooth. They look so sawtooth. So this graph is like a twin to atrial fibrillation. So we can say that this is atrial flutter. Atrial flutter. So you can say that this is atrial flutter in the sense that the P waves are more than the QRS complex, and the P waves look like the appearances of the P waves here are sawtooth. So this graph is atrial flutter and is a twin brother of atrial fibrillation. So this is atrial flutter. This is atrial flutter. Atrial flutter can be regular or irregular. For this reason, so this is atrial flutter. As you can see from the answer here, that atrial flutter can be regular or irregular. This graph shows a regular atrial flutter. It is regular, like we said earlier on, and also the atrial rate is typically extremely fast. Of atrial waves are more than the QRS complexes, and for instance, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. That is the number of atrial waves. The number of P waves are more than the QRS complex, and this shows that the heart is beating so fast. So this is more or less like a twin brother of atrial fibrillation. So atrial fibrillation and atrial flutter are treated in the same way because they are related. They are closely related. So let's look at the next question. Now, for this rhythm, what is the rate? We calculate the number of hertz. 1, 2, 3, 4, 5, 6. The rate here is 60 beats per minute. And what is the rhythm? What is the rhythm? You can see that the distance between a R to another R and from one R to another R seems to be similar or the same. Or we can count the number of boxes between the R's. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. You can see that the rhythm is regular in this case. And does this graph has P wave? You can see it has P wave. It also has QRS complex. It also has T wave. This one also has P wave, QRS complex, and T wave. Like that. But what do we observe in this rhythm? If you watched my previous video, I described these waves as husband, P wave being the husband, QRS complex being the wife, and T wave being the child. And I said that this family must remain together, must be intimate, must be intact. We can see that there is a quiet distance between the P wave and QRS complex. And you see, the P wave is somehow distant from the QRS complex. Another way you can do this is to calculate the PR interval. You can see the PR interval starts from the beginning of P wave and end at the beginning of QRS complex. And the normal PR interval, if you watch our previous video, is between 0.12 and 2.0. Now let's count the number of boxes, the smaller boxes. 1, 2, 3, 4, 5, 6, 7, 8. That is 0.8. So, and each small box represents 0.04. So now 8 times 0.04 that is like 0.32. 0.32. So this is more than 0.20. The normal PR interval should be between 0.12 and 2.0, and this is 0.32. So in this case, the PR interval is prolonged, is elongated. That is, the P wave is too distant from the QRS complex. The husband is too far away from the wife. So there is a block. So in this case, this graph looks like a first-degree heart block. First-degree heart block is recognized by prolonged QR interval. Or another way to note that is that the P wave is too far from the QRS complex. And when you calculate the PR interval, which should be between 0.12 and 2.0, the PR interval is 0.32. That means it's prolonged. So this shows that this graph is first-degree heart block. Let's see if we get this. First-degree heart block. Yes, we got it. This is first-degree heart block. For first-degree heart block, the rhythm is regular. The PR interval will be prolonged at more than 0.2. The QRS complex will usually be normal. So this is first-degree heart block. Now let's take the next question. We can see this graph. Nobody needs to tell us that the electrical activity has ceased. There is no electrical activity, and when there is no cardiac activity, that means the patient is what? Is gone, is dead. So this is a systole. A systole is abnormal EKG graph in which there are no electrical activities, there are no P waves, there are no QRS complexes, there are no T waves. So the graph is flat. So this is a systole. This is a systole. So let's look at this graph. So the rate here is to calculate the number of arcs. 1, 2, 3, 4, 5, 6. So the rate is 60 beats per minute. And what is the rhythm? You can see that the rhythm between the arcs, the distance between the arcs seems to be the same, seems to be regular. Because if we count the number of boxes in between the arcs, they look the same. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. So they look the same. So the rhythm here is regular. And does this graph have P wave? Yes, there are P waves, P waves, P waves, P waves, P waves, and there are QRS complexes. QRS, 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 and there are also T waves, T waves, T waves, T waves. So, and look at the relationship between the family, the husband, the wife, and the child. They are so intact. So, and then look at the PR interval. Let's check the number of small boxes. 1, 2, 3, 4. That is 0.8. 0.8. Here 1, 2, 3, 4 is 0.8. So we can say that the PR interval is 0.8, even though in this rhythm the graph is normal sinus rhythm. Normal sinus rhythm. That is, the P wave is present, QRS complex is there, T wave is there, and the rhythm is regular. So this is normal sinus rhythm. So now this is another question. Let's count the number of rate here. 1, 2, 3, 4. There are 4 R's, and this means that the rate is 40 beats per minute. It is below 60, so we can say that this is a form of bradycardia, but we cannot conclude yet. And do we have P waves? Yes, there are P waves. P waves here, another P wave, another P wave. But this is a P wave that is not followed by QRS complex. So this makes this graph abnormal. Number one, the rate is below 60, so it's abnormal. And the P wave, you know, the P waves, the P wave here is not followed by QRS complex. So there is a loss of a wife and a child. But here, the husband and wife and child, they are intact. But here, the wife and kid leave the husband. So we only have P waves, and this seems like a block. That is, here there is no ventricular contraction because the QRS complex is absent. So there's a block here. So we can say that this graph shows a second degree type 2. Second degree type 2, because in one unit we have P wave, QRS and T wave complex, P wave, QRS and T wave complex, but in the third unit the QRS and T waves are absent and followed by the reappearance of P wave, QRS complex and T wave, P wave, QRS complex and T wave, and the next one there will be only P wave but no QRS complex. So there is a blockade somewhere here. So this is an example of second degree type 2. Second degree type 2. Let's say here second degree heart block type 2. So this is second degree heart block type 2. For second degree heart block type 2, the ventricular rhythm will be irregular. You can see that the ventricular rhythm, which shows the QRS complex, it is regular. That is, at some points we have the QRS complex, in another point it is absent, so it is irregular. The QRS complex, which is the ventricular rate or rhythm, is irregular, and the atrial rhythm will be regular. You can see the atrial rhythm. Atrial rhythm represents the P wave. You can see it is regular, it is regular, it is regular. If you count the number of boxes between a P wave and another P wave, that is the atrial rhythm, you can see that it is regular. Let's say 1, 2, 3, 4, 5, 6, 7, 8. 1, 2, 3, 4, 5, 6, 7, 8. 1, 2, 3, 4, 5, 6, 7, 8. So the atrial rhythm, which is the P wave, is regular, but the QRS is not regular because it is mixing in the next cycle. So next question, what is this wave? Let's count the rate. 1, 2, 3, 4. 4 times 10, that is 40 beats per minute. So we can say that this rate is below 60, which is a form of bradycardia, but we cannot conclude yet. Now, what is the rhythm? You can see that the rhythm is regular. It's regular. 1, 2, 3, 4, 5, 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. So it is fairly regular. And the P wave, is it absent? Is it present? Yes, the P wave is present. QRS complex is also present. You can see. But there's something we need to know here. Look at the distance between the P wave and the QRS complex in one cycle. And in the second cycle, look at the distance between the P wave and the QRS complex. The distance is what is wide. And the third one, look at the P wave here and the QRS complex is, the distance increases from the previous. So the husband is separating from the wife and the kid. In the second cycle, the husband is increasing its distance from the wife and the kid. And the third wave, in the third cycle, the husband has separated. The distance between the wife and husband is so long, is so big that there's no communication. I mean, the communication from the husband to the wife, has to take a long time. So that means if you calculate the PR interval, it is becoming longer and longer than the previous. So how to remember this is longer, drop. Longer, drop. So this is a second degree heart block. When you see something like this, it's a second degree heart block. Now let's look at this one. What is the rate here? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. The number of hours is 13. That is 13 times 10. That is 130 beats per minute. So now you can see that the rhythm is regular. The distance between the hours are usually fairly the same. So it's regular. And then if you want to really know this, in a real world, you can use your caliper to measure the distance between the two hours, or you can use your electronic caliper if you are using the computer. You can watch my previous video on how to do that. So now we can see that the rate is 130 beats per minute, which is a form of tachycardia, but we cannot conclude yet. And the rhythm, the distance between the hours are, they are the same. So the rhythm is regular here. Now, do we have P waves? Yes, we have P waves. This is P wave, P wave, P wave, P wave, P wave. And we also have QRS complexes, QRS, QRS, QRS. And we also have T waves, T waves, T wave, T wave. So, and we can see that the family are united. They are united. So, and the rate is 130 beats per minute. So, we can say that this is a sinus tachycardia. Sinus tachycardia, we have P wave, QRS complex, and T wave, but the rate will be fast and faster. In as much the rate is 150 and below, it is sinus tachycardia. In as much the rate is below 150, is 150 and below, and the rhythm is regular, it is sinus tachycardia. Sinus tachycardia. For sinus tachycardia, the rhythm will be regular with heart rate greater than 100 beats per minute. So, now, what is this? What is this? Let's calculate the rate, the number of hours. 1, 2, 3, 4, 5, 6, 7. 70 beats per minute. And does this graph have P wave? Yes, it has P wave. This is P wave. QRS T. This is another P wave. This QRST, P wave, QRST, P wave, QRST, P wave. And we can see that here the P wave here is close to the QRS complex, and here the P wave is not followed by QRS complex. And so this is a 3rd degree heart block. For 3rd degree heart block, the rhythm will be regular, but atrial and ventricular rhythms are disassociated from one another. The atrial rate will be usually normal and faster than the ventricular rate. That is what. So what is this wave? You can see that this seems to be somehow erratic. It is so difficult to even recognize the QRS complex, so difficult to even identify P wave and T wave. So when you see something like this, we can say this is ventricular fibrillation. In ventricular fibrillation, the waves are, they are wavy. I mean, they look like this. They are wavy. Something like this. Like wavy. So because you cannot really identify any QRS complex and so on, but this is different from asystole. In asystole, the graph is flat, no wavy movement. But in this graph, there are wavy movements, there are wavy appearances, and this represents ventricular fibrillation. It may come in different appearance. It may come in different appearances. Some may be very, very conspicuous that you will know that this is ventricular fibrillation. So this is VFib, ventricular fibrillation. Let's check. This is fine. Like I said, this rhythm may come in different forms. It may be very conspicuous, like very obvious, and sometimes it may look fine, like fine appearances. So this is fine ventricular fibrillation. You can see, very fine, very tiny, So this is a fine ventricular fibrillation. The rhythm will be chaotic and wavy with an unmeasurable heart rate. P waves and QRS complexes are absent. So they are absent. So typically, this chaotic wavy line with varying amplitude will be the defining characteristic of ventricular fibrillation. It is possible that this could be asystole. When in doubt, treat as ventricular fibrillation. Like it looks like asystole, but in asystole, the graph is flat, but you can still see some fine wavy lines in this graph, which may make you think that this is ventricular fibrillation. So now let's look at the next question. What is the rate here? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17. 17 times 10, 170 beats per minute. Oh my God, 170 beats per minute. Now, do we have P wave? Yeah, well, there are P waves. You can see P waves here. P waves, 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 P waves. And do we have QRS complex? Of course, we have QRS complex. And is the rhythm regular? Yeah, it is regular. You can see the distance between the arcs, So it's regular. And do we have T wave? You can see the T wave seems to be matched with the P wave. The T wave is matched with the T wave. With the P wave, the T wave is matched with the P wave. So any rhythm where you see the T wave matched with the P wave and the rate is more than 150, that is supraventricular tachycardia. The basic characteristic of this wave is that the P wave and T wave are merged together, and the rate is more than 150. So this is Superventricular Tachycardia, SVT. Let's check the answer. So you can see for SVT, the reading will be regular and the heart rate will be fast, more than 150 to 250 beats per minute. The P wave will typically be merged with T wave. So next question. This should be our last question for this episode. Let's check the rate. 1, 2, 3, 4, 5, 6, 7, 8, 9. 9 times 10, 90 beats per minute. Now, what is the rhythm? Rhythm seems to be regular, as you can see. Does this wave have P wave? Does this graph have P wave? Yes, there are P waves here. QRS, T, P, QRS, T, P, QRS, T, P. But something is not right here. Look at the P wave and the QRS, the distance between them. The husband and wife are somehow separated. See here too, P wave and QRS complex is too long. The distance is there. You can see the distance. And if you check the PR interval, it will be more than 0.2. Let's say, let's count the boxes where the P wave begins. Here to where the QRS complex begin. So the P wave, the PR interval, 1, 2, 3, 4, 5, 6, 7. 7 times 4. That is 0.28. 7 times 0.04. That is 0.28. So this is more than the normal PR interval. So this looks like first degree heart block. First degree heart block. In first degree heart block, there will be prolonged PR interval, even though the QRS complex will be present and regular, and the rhythm will also be regular. So this looks like a first degree heart block. So thank you so much for joining me in this EKG episode. So the next one we shall be doing will be based on the treatment of each abnormal EKG rhythm. Thank you once again. See you next time.